係，法師好，郭博士好，丹尼斯你好。
大家好，我哋出咗街噶啦。
哦，sorry。
Welcome everyone. Let's just take a minute, wait for the other student to show up. Someone at the Insight Timer said they cannot hear us. Can someone check the sound?
Testing 1, 2, 3. Testing 1, 2, 3.
They said they cannot hear us. Hang on just 1 second. There's a reason for that. Okay, there you go.
Testing 1, 2, 3.
They still said there's yes now. Okay, perfect. I just okay. You have no idea how many apps I'm running right now to make sure that all the social media platforms are covered. Once again, thank you so much. Let's speak a big welcome to Dr. Kwok back after 3 months, and also I noticed that you did a lot of traveling during the summer.
I've been to 6 countries in 8 weeks.
Wow.
But 2 of them were like, a day trip or over, but still.
Now, just a word of warning. Because of the Insight Timer, there was no way for Insight Timer to capture Zoom, so I actually have to use the external mic to route the audio. And so what's going to happen is that you're going to hear a lot of ambient noise, including 2 dogs, 1 cat, and so bear with me on that. So let me, I'm going to just go ahead and turn the podium over to Dr. Kwok. And
All right, I'm unmuted. Thank you. Good evening, everyone. My name is Joanne, or I'm commonly known as Dr. Kwoh at the place that I work in, or how my clients would address me. It's actually KWOH, Kwoh. I am going to begin sharing screen now from my other laptop. We are going to talk about anxiety tonight, or this evening. So we want to understand what anxiety is and how we can manage it, because anxiety is a common human condition that every one of us experience. Almost every living thing experiences too. So I hope to have an interactive workshop where we successfully last quarter, with the assistance from Dr. Jenny Mew and Dr. Venerable D. Hong, helping me with providing the questions, or highlighting the questions from the participants who are attending this workshop right now. So when it's a workshop, it's not just me talking, it's me sharing my experiences with you, and you're welcome to share your experiences via the chat, or some form of written tool that Dr. Mew can see and therefore share with us during this session, and then we can probably help each other understand more about what we are going through in our lifetimes. So my workplace is University of the West. I am an associate professor of psychology, and I'm also the chair of the department. I also am a registered psychological associate, registered PA. What that means is that I'm a pre-licensed clinical psychologist, where I see patients, or see clients under the supervision of a licensed, in this case, neuropsychologist. And we also do neuropsych assessments. If you have more questions or you're curious to find out more about those, if we can manage time this evening, I'll be happy to share with you. I'm also a very avid volunteer with various organizations. The two organizations that I volunteer with most frequently would be Free Mom Hugs. Oh, I did say that I'll turn off the closed caption. All right, I've turned on the closed caption. If any one of you needs or wants the closed caption to reappear again, please let Dr. Mew know, and Dr. Mew can interrupt me anytime. So I am a volunteer with Free Mom Hugs organization, Free, Free, Mom, MOM, Hugs, hugging. And this is a national organization that I found when I was doing my dissertation research back in 2019. I will let you maybe Google what Free Mom Hugs is all about, but we are advocates and in some sense activists for the marginalized population, commonly known as LGBTQIA+ populations. And we go out there, we do community outreach, we hold events, we participate in Pride March just to show support and give support to those who need them. And I'm also a volunteer with Animal Rescue. It's called Basset Hound Rescue of Southern California. I recently became one of the board members last year, but my main role is to take care of the social media. If you are interested to find out about them or know more about them, we can chat later on if we have quality time left this evening.
Joanne, can you turn the closed caption back on? Someone needs that.
Okay.
Someone didn't mind it.
All right, it's back on. Thank you. All right, without further ado, I will start my presentation tonight. So today we are going to talk about anxiety, but mostly about understanding it. Before we start our workshop, some reminders, gentle reminders about our guidelines. We speak one person at a time. Luckily here, it's for me that I can't hear you. No one can interrupt. But of course, if there is a chat going on, Dr. Mew and Van De Hong can help me understand what the question is, what the comment is, and we can hopefully address that at that time. Then if not at the end during the question and answer. We want to be respectful both for our attendees and for ourselves. No judgment here. And we are going to be very gentle with ourselves and others. What that means is that when we speak, even if there's a disagreement, even if there's a sentiment that we don't necessarily see eye to eye or feel differently about, we want to be gentle about how we voice that, not just with others, but also with ourselves. Because sometimes we might think that, oh, that's something that I identify with. And we might be harsh with ourselves using some words that, you know, we don't realize that we are not being gentle with ourselves. Whatever is spoken and used here, first of all, if we were to use a scenario, a case example that we have lived, experienced, witnessed in our real life, without the person's permission, we should not be sharing it, identifying certain traits or identities of that person. And even if we did, we hope that it is used here to illustrate a certain scenario for us to understand it deeper, better, and not for us to, you know, later on say, oh, I heard from this workshop, this and that, and this person by the name of Joanne has been sexually assaulted at age 4. And I wonder what that family is like, not for that kind of use, but more for us to share and get a deeper understanding of what we're discussing at that moment. And this is the agenda for tonight. So we will talk about what anxiety is. We will have a comparison of what day-to-day anxiety looks like and how an anxiety disorder may present itself. We'll talk about the risk factors of a person, it's more at risk to living with an anxiety disorder. So we will have an activity in session later on. And I remember 3 months ago, last quarter, when we had that in session activity, it actually went very well, where participants would submit their responses to Dr. Miu, and then he communicates with us that way, and we could address it almost immediately. And we hope to be able to share some effective strategies about how to manage our day-to-day anxiety. And then we hope to also allow time for some questions from the participants. All right, what is anxiety? So the definition of anxiety, it's a feeling of worry, fear, or unease. Most of the negative description here. So worry, fear, unease that arises when we are in stressful situations. It can manifest mentally and physically. Before I go ahead and describe what could those manifestations look like, let's talk about this feeling of worry, fear, or unease. Last week, semester began at our school, or in most colleges. I had a student who came to me. We had an annual one-on-one conference. That's the benefit of a small university. I am able to see my MFT, which stands for Marriage and Family Therapy trainees, on a one-to-one conference. And the student brought up about anxiety, and the student stressed that, anxiety is not bad. Anxiety is okay. With anxiety, like for example, performance anxiety, then we can do better. Very true. But I do not agree that anxiety is a good, positive emotion or a phenomenon to always experience. That was what I was trying to explain to my student. Having anxiety is not the best experience, but it's a basic, a necessary human condition that all of us experience. And I was saying in the beginning that, even animals experience anxiety, like, separation anxiety, right? So how do we differentiate that it is a stress or an anxiety? We will go into that later on. Once we know that it is a stressor caused by a stressor and anxiety caused by a stressor, then we can maybe differentiate that is this stress or is this anxiety? And when it comes to stress, there is eustress and distress. Eustress spelled EUSTRSS. Let me see what the closed caption say. Almost there. EUSTRESS. And distress is spelled DISTRESS. So now we have the positive and negative. Eustress is still stress, but it's something that would drive us to perform better and something that we supposedly have learned how to manage and cope with. Distress will cause us negative emotions such as worry, fear, or unease. And let's look at how they can manifest mentally and physically. So real life examples of mental stressors or mental or anxious emotions that we experience. It could be a fear after hearing a crash or a noise from the bedroom, like you're doing work, all of a sudden there's a crash from the bedroom. Ooh, what is that? A fear or an unease or discomfort or worry. Maybe something fell from the bathroom that you need to go fix it. Well, we also can experience anxiety when we need to share bad news. In my case, Venerable Dr. D. Hong would also share the same emotion, I guess, when we have to share a bad grade about an assignment with a student. We might have certain expectations of how the student would react, and therefore we have the anxiety of, or the unease of, how can I counter what the student is telling me? Or maybe when we are going to share some bad medical news. That might be a personal trigger for some of us right here, if we have experienced that. Speaking in public, like right now, trouble with focusing, repeatedly replaying scenarios in your head. These are all the examples of mental manifestations or expressions of what worry or fear or unease when they take over our attention at that moment. Before I go to the physical manifestations or presentations of anxiety, I would like to stress one thing. Our brain can only focus on one thing at a time. Multitasking is a myth. We do different things at the time, but what we can really perform well is that one task that we focus on at the moment. So imagine our attention, it's like it's that little thing that you ride on a little horse, a merry-go-round. So there are so many things in our mind. It is scientifically proven that everybody has 50,000 to 60,000 thoughts a day. I think I have 110 to 20,000 thoughts a day. My thought can jump from one point to another point very quickly. But it's only when we bring our attention to that forefront of that matter that we are focusing on that thing, and our brain will let the other things go. So if we are anxious and we are focusing on that matter, that situation, that condition that's causing us anxiety, we will definitely experience anxiety at that moment. So we will talk about how we manage anxiety, and I'll come back to this point later on, how to bring your attention to other conditions, matters, scenarios that doesn't cause us anxiety. So real life examples when we react or we present anxiety, we could be shaking or trembling. We could be lightheaded. We have repeat heartbeat. We can experience headaches or migraines, muscle pain in the neck, shoulders, and back. Sorry, I want to go back to this. Is this resonating with some of you? This part here? Think about it, and then, during question and answer, we can talk about some of these. So as I emphasize, I reinforce, it is normal to experience anxiety, even more than occasional. I know some people experience anxiety almost on a daily basis, and it does affect all of us. It's how we first differentiate, is that a stress or anxiety, and then break down the stress to, is it eustress or distress, or even better, gain some tools, coping mechanisms to kind of reframe or change the distress or factors that cause distress and make them eustress. Because there's no avoiding stress in our life. If we don't have stress in our life, we are not living. Everybody experiences some kind of stress. And how does stress become anxiety? We will talk about some of those. So it affects people of all ages. So this is some kind of an interaction time now. If you think that a child does not experience anxiety, you're living in the 60s or 50s. Ever since then, research and public education, community outreach have proven that our children as young as 3 years old can experience anxiety. Even 1 or 2 year old, when they experience separation anxiety, that is still kind of some form of anxiety. So if you want to share with us, what do you think a 6-year-old or an 8-year-old, how can an anxiety present itself in a child in that age group? Dr. Bill, I would like to borrow your service to see if there's any response in your other platforms, and you can share with us.
So far, I only have 2 yeses, and I think that was to an earlier inquiry about whether or not they experience anxiety, but not yet.
Okay. So an example of a child in that age group will be maybe speaking in class when the teacher asks the child to speak about a certain, chapter, or a child who is picky about food and is afraid of being bullied about being picky about food. Those kind of anxiety might surface in that age group. What about a young adult? What kind of anxiety can a young adult face? Do we have any responses, Dr. Mill?
Someone says bedwetting, but that's to a younger group.
Yeah, the group. Yeah, actually, thank you for reading my mind. The bedwetting. Yeah, I was thinking of my own childhood experiences where I remember in second grade, that's primary 2 in Singapore, there was a classmate who would always defecate in class. So I would imagine the anxiety that the child would have gone through during that age group.
And someone says, I think this is to the slightly older group, which is not sleeping, work anxiety. People in menopause can start doing it also, apparently. That was another comment.
About bedwetting in menopause?
Menopause, yeah.
Okay, interesting. So some of the examples for this age group, young adulthood, social connections, work pressure,
Someone says loss of appetite.
loss of appetite is causing anxiety. Or the other way around too. What about this age group? Maybe more of, our age group right here between 30s and 40s. You don't have to go by the picture, the cue, but if you are in that age group, what is a common stressor? What is the number one thing that gives you anxiety right now?
Actually, someone commented about the young adults' fear of asking for help and guidance at a job, not wanting to appear unaware of their responsibility. That was a good one. Insomnia is another comment. Health, anxiety, money. Yeah, that's another comment. Providing for my family, that's one. Yeah.
What I would like to pull the positive from that is that those issues are kind of universal, right? So we are not alone in this. So we worry about money. Why? Because we have obligations. We have financial obligation. We need to pay for the house. We need to pay for the car. We need to pay for the electricity that's running right now. We need to pay for the internet, the phone, a lot of obligations. They might look like $100 here, $100 there, but it takes up the whole paycheck. And then sometimes when we live paycheck to paycheck, we have to worry about which bill do I pay for first.
Yeah.
Right?
Well, the last four comments are pretty universal, I think, starting with being afraid that you are going to lose your job and not be able to get one. Another one is retirement funding, declining health, and impending loss or grief.
I think it kind of boils down to
aging is another one.
financial security, huh? Financial security. Yeah. About how we should sustain now and then how to provide for ourselves when we somehow or rather lose the ability to earn a stable income. How do we sustain ourselves? I want to touch base about someone who mentioned health anxiety. That is something that's very prevalent to me now, and I think to a lot of middle adulthood. I recently read a survey, or maybe it was a TV program, that when do you start worrying about your health? Some people say, oh, in my 30s, some people say in my 40s, some people say in my 50s and 60s. I think those people who say 50 and 60s, you are very fortunate that you never have to think about your health during your early adulthood. So health anxiety is something that most people begin to experience when we begin to feel the aging process, and that we're not functioning as before. There is also more anxiety when one gets older, when we lose our partner, when we lose our familiar support, when we truly lose the hireability, that people stop hiring us because of ageism, or because we don't have the ability to drive to work, or maybe because we are not as literate as and the next person, on the internet, and we start to lose the social connection. So it is true that anxiety affects every population, every demographic. But do we all have anxiety disorder? Quick yes or no? Do you think you have an anxiety disorder? I say no myself first, but we'll go over that. What about people here? Dr. Miu, do you think you have an anxiety disorder?
I
Bendy said no.
yeah.
Okay.
Yes, yes, yes. That's 3 yeses.
Ay, ay, ay. Okay. I don't have my DSM with me, and this DSM stands for Diagnostic and Statistic Manual of Mental Disorders or Mental Illnesses. And clinical psychologists or licensed therapists such as LMFT, LCSW, we use that to diagnose people. And usually for anxiety disorders, I'm not going to talk about all the other disorders. For anxiety disorders, the symptoms have to persist for at least 6 months, and it has to interfere with your functioning. So for those of you who answered yes, let's go through some of these exercises and see if you still feel the same at the end of our workshop or towards the end of our workshop. So anxiety, like I said, happens in everyday life. We worry about bills. We worry about our health. We worry about our children. We are worried about if the internet is going to be strong during this presentation. I didn't worry. I just thought about it per se. However, when nervousness becomes overwhelming and makes everyday life more difficult, it may be an indication of endowing symptoms of an anxiety disorder. And anxiety disorder affects around 4% of older adults worldwide that have been recognized and diagnosed. The percentage is higher. How do I know if I have anxiety disorder? For those of you who, thank you for sharing that you feel that you have anxiety disorder. Does this speak to you? If you feel that you're constantly anxious about your everyday life, even after positive events or about positive events such as a birthday, a wedding, school starting, having a new puppy, then I think it might be time for you to consult with your primary care provider to discuss more about anxiety. So we are here to help us recognize the difference between everyday anxiety and an anxiety disorder. Again, disorder is diagnosed if it impedes your daily functioning and it has persisted, or the conditions, or rather the symptoms have persisted for 6 months or more.
There are 3 more yeses, and that was asked after you asked if they feel that they have anxiety disorder. So one says yes, and actually qualified by saying that it's diagnosed as a disorder. Another person says it actually with medication it has helped, has his condition has improved. Yeah, so definitely. This is a good topic.
Thank you. And yes, sometimes we need to start with some medications. I am a psychologist, so I don't prescribe. And I went this route. Number one, I wasn't going to medical school, but number two is that I believe in holistic and also quote unquote alternative therapies, and therefore long-term therapies to help us cope with, scenarios, conditions that we are able to use without medications or medical interventions. But I'm not saying that medication is not necessary. It is very necessary for certain conditions that, at least with it as a start, we can take care of what therapy cannot intervene with first. And then once the condition is conducive for psychotherapy or other therapies to take effect, then we can go forward with more interventions. So is it a sign of personal weakness that a person has anxiety disorder versus another person who doesn't have anxiety disorder? So Dr. Bendy Hong and myself, we identify as, we don't live with anxiety disorder. Does that mean that I'm better than you. No, it's just that maybe we have less risk factors than those who live with anxiety disorders. And what these risk factors could be: stressful life events, a death of a loved one, trauma from childhood. It could be really money issues. Sometimes things are just not working our way, like in between jobs. Or maybe we were promised a good job and therefore we quit the last job and then something happened. And then now we are not having an income. It could cause a lot of issues. Limited physical mobility. Some of us are differently able. For example, we can't hear as well, we can't see as well, or maybe we have mobility issues that could that could increase the risk for anxiety compared to the person next to you. Loss of independence can cause a lot of anxiety. For example, I can't drive anymore, or maybe if I lost a job, I can't be financially independent anymore. Someone said insomnia earlier on during the questions of how anxiety could manifest in certain age groups. It's really, in my opinion, a chicken and egg thing. You don't sleep well, you're more at risk for anxiety. Or when you have anxiety, you don't sleep well. Those two really go hand in hand per se. Not a good relationship, but a true relationship. Genetics. Anxiety does have the same neurotransmitter, big word, neurotransmitter to quote unquote blame on. And actually serotonin, it's a good neurotransmitter, but it is because of the irregulation of serotonin that sometimes people with depression and people with anxiety disorders are prescribed the same kind of antidepressants. There are even studies out there that antidepressants treat certain kind of panic and anxiety disorders better, and certain kind of anti-anxiety medications treat depression better. That's a whole different class altogether in psychopharmacology, which we will not be really going over today. But to relate that to genetics, so it is something biomedical. It is something that is treated by psychopharmacological methods. So if you have depression in the family, there might be also a chance of you being a greater risk for developing both depression or anxiety disorder. Chronic health conditions, I can see how someone with health anxiety develop a disorder because of constant worry of what's going on physically. And anxiety can be caused by some medication, can be a side effect of a medication. Last but not least, alcohol misuse or abuse. If you are taking alcohol on a daily basis, you're more at risk for anxiety for sure. All right, so we're gonna do more interactive exercise here. So what's gonna happen is I will give you a statement. You will say whether it is an everyday anxiety situation or is it an expression or a symptom of an anxiety disorder. You ready? Let me reiterate what is an everyday anxiety. It's a sense of fear, worry, or unease during an uncomfortable situation. Once the moment has passed, you feel better. Not immediately like before, but you feel better. You don't continue to feel fearful, to worry, or to be uneasy. Anxiety disorder may present itself by you having constant worry about things even after months and years have passed, or a constant worry about the future, even if those scenarios, the factors are out of your control. And in addition, like what we said earlier, what one of the slides say earlier, we worry, uncontrollable worry about even a positive event such as, wedding, birthday, good results. So the first statement here, worry about paying bills. Is it everyday anxiety or an expression of an anxiety disorder? I give you a few.
Someone says every day.
Okay.
Come on.
Any more responses coming up?
Every day, another one, 3 every day. And then someone says depends.
Depends is always the best answer, no?
But it actually really depends, right? If it's just one time, or is it every time, or is it that you can only make minimum payment and now everything's piling up? It really depends. Yeah.
Mm.
Okay, that's it.
All right. So,
Someone says, can you talk on intrusive thoughts and rumination play into anxiety disorder? I experience it every day. And then someone says, I agree, it depends on your financial situation. Someone says, don't worry anymore about bills. Okay.
well, it's largely an everyday anxiety that we kind of have the thought, maybe worry is a big word. We have, who didn't think about paying bills today? I think about paying bills every day, different kinds of bills. I think about, okay, when's that next bill coming for my car installment? When is our next cycle for Spectrum, or next cycle for Edison, right? Edison for energy. So we think about them. And if, like one of you said, it depends whether we have the resources or not. We might worry about it. Or if we already set up, according to what the cycle is, and we know that we have funds in the bank that will take care of it, then we think about it and we don't worry about it. But it is natural, because it is a natural worry, because we are responsible beings. If you're not responsible about paying your bills, what might we end up? Being transient, being uh in debt, right? So it is an everyday anxiety per se. But of course, if it becomes intrusive, that's a different story.
Someone says, I worry most about the future. Intrusive thoughts bring up worst case scenario of things that I have no control over.
That's a true form of anxiety, but whether it is a disorder or not, it depends on those two rule of thumbs that I was mentioning about. It has to be persistent for at least 6 months, and it has to impede your everyday life. If you're still able to get out of, your house, you're able to perform a job, you're able to pay your bills, thoughts are going to be intrusive. Is how we manage them and make them go away. Embrace it. Yes, I acknowledge you, and move on. Sometimes some thoughts are more intrusive and more pertinent than the other, but we'll get to that too. Thank you for sharing that. All right, second statement, second example. Constantly worrying about things by replaying things in my head, and that it causes me distress. Remember this word, distress? And I can't do anything else the whole day. Someone mentioning intrusive, this might be it, intrusive. Do you think this is an everyday anxiety or an expression of the disorder?
Someone says disorder.
I think Bendy also.
Another disorder.
Just give it a few more seconds, because
Another one, so 4 in a row.
all right. It is an expression of the anxiety disorder. It is intrusive. You're constantly, so the keywords here are constantly replaying distress and can't do anything else the whole day. It impedes your functioning. It affects your daily functioning. and that you can't do anything else. Third one, avoid social situations because of fear of being judged, embarrassed, or humiliated. Avoid social situations because of fear of being judged, embarrassed.
We have one disorder. Two, three, 4, 5.
Thank you. Thank you for all the responses. I guess we are very psychological, or rather psychology concepts sound in this group, right? Because the keywords here is avoid social situations because of the fear. Everyone gets judged. It's quite common day occurrence that sometimes we feel embarrassed, humiliated. I want to say, for me personally, I haven't had that feeling for a long time. Thank goodness. Maybe because my skin got thicker. I don't know, but I feel that there are always people out there judging. Whether or not you take it personally or take it to heart, it's up to you. So people judging, it's out of your control. You taking to your heart, you taking it personally, is within your control. So I want to say that I don't feel humiliated or maybe even embarrassed for a long time now. It's because I am able to differentiate the factors of control. I know what's within my control, what's not within my control. Every time if I were to analyze or, look at the feedback of what I've just done, and I feel that, I've done my best, that's what I can do. You can think it's not good. You can think that it can do better. And if you were to give me that feedback, I would totally appreciate it. It's about the growth mindset, right? That if you are able to take criticisms, if you are able to understand that when people tell us what they feel that can be done better, is them helping us to grow, then there's no opportunity or room for being embarrassed or being humiliated.
Yeah,
But
I was initially I was a little taken back by this scenario until you point out that the key word here is avoidance of situations. So then I understand that. Now we have a couple of good comments. The first one was that I feel like part of the disorder is the irrational fear. And then someone kind of concur and says, is it irrational or is it a learned behavior? Like a trauma response. Someone says like a trauma response. And then someone added that, I mean, it could be both. It's more of a making up scenario would never happen. Like if I got one failure in elementary school, I wouldn't ever get into college.
Yeah, and we're talking a little bit about CBT here, which is cognitive behavior therapy. And that's the CBT school of thought by, I believe his first name is Robert Ellis. When we talk about irrational thought, so irrational thought, irrational fear, the fear comes from the irrational thought per se. So when we say irrational thought, we are not saying that, oh, that's ridiculous. But in the therapeutic setting, for example, I think the example that you just saying that that I cannot go to college, that we will try to challenge that belief that causes that irrational thought per se, and that's without judgment. That's just the therapeutical language that we say is an irrational thought, because who has given you proof that you cannot qualify for college? So in the therapeutic setting, we will challenge that irrational thought, which causes irrational fear. And then we get to the bottom of it, get to the root of it. What is the core belief that causes that irrational thought? So irrational thought, irrational fear, more or less the same. But we have more examples coming up that can help us see what can be an irrational thought or irrational fear, then we can use for this exercise here. So Dr. Mew is correct about the keyword here, the avoidance. So we are all judged. We are all kind of, concerned about being judged, about, being embarrassed about not knowing what we're talking about, or, people judging us about who we are. But we still go out there and be brave and live our lives, right? But some people, because of the presentation of an anxiety disorder, can become agoraphobic, meaning they don't leave their house at all, or they avoid public speaking, or they can't speak in class. I have very, very excellent students, very good writers, very good understanding of psychological concepts, but they cannot speak in class. They physically shake when I say their name and ask them a question. So there are some things that are still, we still work on, but it comes up, it's manifested so clearly and obviously that we truly, because of the discomfort, the unease, the fear, we avoid, because that's causing us a lot of, I want to say trauma, but that's not the correct word. I want to say a lot of, what is that word? A lot of unpleasant emotions, negative emotions, and therefore we avoid that situation.
There are two comments that are, I think, very good. One is that I practice CBT and DBT because I have panic and anxiety disorder. And then I'm not sure I understand the second part, which is, and exactly, it is just the semantics of the language. Okay, so maybe you can, the student can elaborate on that. But then the another comment says, I read recently you fear being judged, not you and I, but just, in general, a person fear being judged because you are because you are judging others, either yourself or others. Is that really true?
How true is that, right? We are always the mirror of what we think, right? When we project what we are thinking. So if you think that people are judging you, a lot of time that you are judging others too, right? And therefore you think that people are doing that because you experienced that yourself. So I kind of understand what you're saying. But the semantics of the language thing, allow me to address it towards the end after this exercise. And I'll try to understand more about what the statement is about, and then we can continue to share and learn from each other about that feedback. Next statement. We have about 10 statements altogether. Time check. We are good. We are at 6:47. So we can continue to share these statements here. So is this an everyday anxiety or an anxiety disorder symptom? Feeling sad, anxious, or having difficulty sleeping immediately after a traumatic event. A traumatic event can be a car accident, falling down, physically, or someone who passed away in your life.
I got 3 every day in a row.
Okay, in the interest of time, please continue to give your feedback to Dr. Mew while I move on to the answer. Yes, it is an everyday anxiety, because immediately after a traumatic event, if you're not feeling sad, anxious, or having difficulty, I don't know if your emotions are intact, because we are supposed to have reactive emotions, and that is part and parcel of how our human experience is. So immediately after a traumatic event, it's natural to feel sad, anxious, or even experiencing insomnia.
Someone asked, I hear if it lasts more than 6 months, it becomes a disorder. Is that true? I think you said that, right?
Yeah, I said
Yeah,
that if,
yeah.
and
That
it's
was
not
one of the
just one
criteria.
symptom. So the one symptom, it could be, being sad, anxious, or having difficulty sleeping. And that's one symptom only. Another symptom could be hypervigilance. Another symptom could be paranoid. So there are, I can't remember off the head how many symptoms you have to qualify before you are diagnosed with anxiety disorder. But the other criterion is definitely true about being 6 months, consistently having those manifestations of symptoms, and that they are impacting your daily functioning. Okay, next one, realistic fear of a dangerous object, place, or situation. Maybe you're walking on a 10-story high building and there's no railing and you feel anxious about it. Or maybe someone's walking around you with a knife. Or
I have 3
someone's
every day.
throwing objects.
4, 3.
Quite obviously every day, right? I mean, if you're not anxious about those things, then I don't know why and how you survive to your age right now. These are our survival instinct. We are supposed to be fearful of things that threaten our survival or our livelihood per se. If we are not anxious about them, then we will not be able to avoid them or problem solve them. Like, for example, if you're walking on a 10-story high place without railing, maybe don't go near the edge of the building. The anxiety will tell you you might fall. Don't go there. It's going to cost you your life. And therefore, you are surviving because you have that natural anxiety.
I think that's why one of the earlier comment by one of the students that says, that talks about anxiety disorder, it depends, and depends on whether it is irrational or learned experience. So I
Sure.
think it really applies to this one, right? Because we all have different experience. Some of us have experienced certain kind of danger and get very sensitive to it. And sometimes it's very difficult to explain that to someone who hasn't experienced to it. And so
Thank
they
you.
could look at that as disorder when in fact it's just a learned experience.
Well, if you put two people together on the 10-story high place, and one person will say that, okay, I might fall. Oh, I'm scared, I'm leaving. That is everyday anxiety. It's someone, while we talk about this, cannot even step out of the house because the possibility of them visiting a 10-story high place or even getting into an elevator. Now, that is irrational fear because they're not even there yet, or they're just thinking about it and having anxiety. So it can be same scenario, but different reactions to it. Conditioning, there's argument out there, debates out there. Everything that we do, it's a conditioned learned behavior. I do somewhat agree with it, 99% of it. Although some of our behaviors have biological basis, but everything that we do is a learned behavior per se. So the person who does not even step out of the house to go to that 10-story high building, sometimes if it's because of a learned experience, that's not irrational because they had an experience of maybe falling or witnessing someone falling. But if someone has not even witnessed that or learned about that, it could be irrational. And that's definitely a number one symptom of a disorder. When a panic disorder or an anxiety disorder is involved, we're talking about there is no rhyme or reason for that fear to surface. That's a
We have a very good comment here. That's a first person experience, and she said, I have fallen from the 4th story from a building, and I have not been able to face height ever since. No, so that's a learned experience. Now that's why when you first asked me, Danny, do you think you have anxiety disorder? And I kind of laughed because I couldn't answer because I don't know the difference between anxiety disorder or anxiety personality. Because for someone like that who actually have experienced a trauma, for us who hasn't had that experience, we could think of that as irrational, but it's just part of that person's learned experience, right?
Back to your comment, that's more of a response to a trauma. So it's more closely related to post-traumatic. In the older edition of the DSM, which is the Diagnostic and Statistic Manual, PTSD used to be grouped under anxiety disorders. PTSD now, it's a whole new group of disorders under stress disorders altogether. So they're closely related, but I would say the example that you just read me, it's more of a reaction to a trauma and not classic anxiety disorders presentation per se.
Yeah. The student has a follow-up comment, and he or she said the goal would be to face the fear, right?
Well, it depends on how equipped you are to face the fear. Even, there are many ways of interventions, such as exposure therapy, systematic desensitization, and so on and so forth. Some people just do it on their own. I think it's more of, in the school of thought of CBT, is to challenge that irrational thought. Because although your incident was very real, you fell from a structure from 4-story high, and it was a real experience. But if you took precautions, what is the possibility of you falling again? So that challenging that core belief of I will always fall versus if I take care of my risk factors, I will not fall again, then I will not be afraid of walking on a 4-story high building. So it's challenging an irrational thought that comes from a core belief of something that is not quote unquote true. Yes, in simple language, you can interpret that as overcoming your fear. But in school of CBT, it's challenging that irrational thought that is coming from a core belief that may be untrue. Does that answer the question?
Someone says, yes, thank you.
Thank you. All right, the next one, random panic attacks and keep thinking and fearing of having another panic attack. Everyday anxiety.
Someone says disorder, another one.
Very much so. I earlier mentioned that panic attacks sometimes have no rhyme or reason. I am a survivor of panic attacks. I did manage them before it became a disorder. That means I didn't let it last for 6 months, and I did not let it impede or affect my functioning. I'm a public speaker. I used to teach group exercise. When I was at the peak of my symptoms, I needed my husband to sit right next to me or near me where I can see him when I was teaching a group fitness class, because I have the irrational fear that I will pass out in class, because I have the irrational fear that something might happen to me when I'm teaching that class. Prior to that, I was doing everything that I needed to do. I was teaching yoga, I teach Zumba, I was even doing Tai Chi. That if you were to look at, lifestyle, there's no rhyme or reason that I should have a panic attack. But it did happen to me, which I later did rule it out as a biological root, because I was experiencing premenopausal symptoms and my heart rate was really going up, that I did not realize that my blood pressure was skyrocketing. And I'm very happy to say that I have managed that since the last episode. I think for the past 10 years, I've been doing okay. All right, next statement. Worrying about important events. Is this an everyday anxiety or an anxiety disorder?
I've been worried about worry about things going wrong for today's session. So I don't know if that's disorder or just regular anxiety.
It's strange that, I think earlier on I also said this. I thought about this, but I wasn't worried. I thought about, because today I have back-to-back events. And last week when Dr. Mew reminded that, hey, we have this workshop this next Tuesday. And I had a quick thought about, maybe I should not have it because my day is packed. But then I thought, no, I should go ahead, and have it. And I did not have a single worry about this not happening. I don't know, it's maybe because of my meditative practices, or I already kind of understand how CBT would work with me, because we will use the funnel system and say, if this happens, what does that mean? Okay, if the internet doesn't work, then what does it mean? I won't have a presentation. Or if I'm late, what does that mean? I won't have a presentation. And at the end of the day is I will ask myself, what does that mean if I don't have a presentation? I may have caused inconvenience to all of you, which is a really big regret, but life still goes on. I don't die. Nobody dies. We can reschedule this. So I'm able to be at peace with that thought, and I don't have a worry about it. So maybe because of life experiences, maybe because of my CBT school of training, maybe because of my meditation or meditative practices, I did not, Dr. Mia, I'm serious, I did not have a worry about today at all. At 4:30, when I finished my class, I said, all right, guys, you guys go. I didn't even tell them that I have to rush home in an hour or so. I have faith in the traffic. I was a little bit more, it took 10 minutes more than I planned, but I thought to myself, if it happens, I have Dr. Mills' contact. I will let him know that I'll be 10 minutes late. I did not have a single worry about it.
Yeah, if you don't show up, I'll be so anxious that I can definitely be the speaker. There's a comment here that echo what you said about earlier, and says, "I am right there with you with the premenopausal random anxiety and panic attack. Very life-changing."
Everyone was just flabbergasted about me having a panic disorder or having panic attacks. They were like, no, you, even the doctors, when I went there, they're like, you have panic attacks? So it's something really you can't tell from the surface. Sometimes it's really factors that we cannot control within, our areas of our locus of focus. What is that thing called? Locus of control. So worrying about important events is an everyday anxiety, like Dr. New and I illustrated. Let's see. Nervous or sweating before performing or speaking to a crowd of people. We all know that. Today, my heart is not racing. Sometimes my heart is racing, even if I know the topic inside out, even if I know the 10 people in the meeting. When I know that I'm going to speak next, my heart will start racing very quickly. That is a physiological reaction that I have no control over. But what do you think? Is it an everyday anxiety?
I got 3 every day. Yeah.
Today, my heart is okay. Some days, even if I'm having a meeting with my colleagues that I know, but when it was my turn to voice something, my heart just starts racing automatically. This is our system responding, pumping blood to wherever the body needs it to increase our performance level per se. It's miraculous. It's marvelous, I think.
I think sometimes, I think sometimes everyday anxiety can actually give us an edge. I think, for example, I believe you and I and Venerable Dihong as well, we're so used to speaking in front of people. Sometimes we don't actually want to be over prepared.
Yeah,
because that
absolutely.
anxiety will actually give us an edge and we actually perform better.
Time check is 7:03. I actually do have some time today, and I would like to ask for your permission, everyone here, all the participants, Dr. Miu and Vandy, if you would like to extend this 15 minutes more, because I would like to
absolutely. Do you so is this the end of the presentation?
Well, we've got, I think, this and another one more. I mean, this may be the last one. Last one, irrational fear or avoidance of an object. I think we get a hang here. When we see irrational, when we see avoidance, when we see that this is something that affects our functioning. What is it? Is it everyday anxiety or is it a disorder? Is everyone answering with disorder?
I have no comment yet. Well, one disorder, but actually there was a comment before that, and I didn't have a chance to say it. And the person says, "What about when that psychological event happens for no reason and very often? Can this be related to disorder?"
Can I understand a little bit better when a psychological event
just
happens?
happens for no reason and happens very often. Is that a disorder?
I don't understand what they mean by
Oh,
psychological.
I think that's related to one of the question where anxiety about speaking to a large group of people. That was a psychological event. I think that was unless I'm wrong.
Maybe I'll back it up.
Yeah.
Is this the one?
After that, the one we were saying about, the anxiety about speaking to a large audience, and then I think that was the one.
This one?
Yeah, I think that comment was meant.
Yeah, and then I said my heart would race,
Yeah, I
but
think
that's a physiological
yeah.
presentation though. That's why I wasn't understanding the psychological part.
I think I misspoke. It's physiological. Sorry,
Okay.
physiological. Yeah,
So
sorry.
can you now repeat what they say? So when that
What about,
physiological,
okay, the question, I think the question is, what about when that physiological event happens for no reason and often? Can this be related to disorder?
it could be precursor of a panic disorder, but we have to understand the stacking order of how panic attacks become panic disorder. So panic disorders are, listed under the group of anxiety disorders. Panic disorders could start with panic pangs, PANG pangs. So like all of a sudden we are lying down and then we have a sudden anxiety attack. Oh shoot, I haven't done the preparation for tomorrow's presentation. That is an anxiety pang, and that has a rational root, a rational thought, and it's a rational fear because you didn't do anything and you're going to be what? Judged, right? And you're fearing embarrassment or humiliation. So if that one has a reason and you have that sudden a pang, everyday anxiety, but this physiological symptom of you all of a sudden feeling anxious, or what happened to me was I was just driving the first attack. I remember it very well. All of a sudden, my heart started racing and I was blacking out when I was driving, and it came out of nowhere. The first time I recorded it quietly, I noticed it and I didn't do anything about it. The second time when it happened, I started talking to a doctor about it. And then when it happened almost on a weekly basis, and then that's the thing about panic disorders. It will happen more frequently and more intensely if it's not taken care of. There is a reason, definitely a biological explanation to it, and sometimes also a psychological explanation to it. For me, anecdotally, my explanation was the premenopausal biological base. My system was going haywire because my blood pressure was going up. So the system is giving us alarm bells. Ding, 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 go check your blood pressure. And true enough, my blood pressure was always 120 over 80. And then all of a sudden it was 140, 150. At the one episode that I had to go to the emergency room, my heart was racing to 200 beats per minute. I was just lying down. So something was not going correctly. So there is an explanation to it. And if it's a physiological event, like we say, the nervous or sweating without a precursor, without a reason, without a rational reason, a reason, definitely consult with your doctor and have a very thorough checkup about it. It took me 4 years to find out what's going on and to go on a very, very light dose of blood pressure medication to help me stabilize what's going on. I hope I'm addressing the question and the comment.
Yeah, there are two follow-up from the same student. One is that this would be that response with no seeming stimulants. I think that's referring to the physiological response. And then immediately after that, it says, I've been told that this is a somatic response to CPTSD, which is, I think, when you were saying about your heart rate going up and yeah.
CBTSD.
Hmm.
What does SD mean? So if I understand CBT as cognitive behavioral therapy, and what does SD mean? Can you help me understand?
I don't know. I don't know. Anyway, I let's see. Because of my hormonal imbalance, there's a different student. Oh, chronic post-traumatic stress disorder, CPTSD.
Okay, I
Okay.
thought
But
CBT.
anyway, there's another comment from another student says, because of my hormonal imbalances, is there any type of therapy or practices you recommend? Anything related?
Okay,
Anything
hormonal.
help you other than HRT that I would love to do therapy and could help instead?
So first of all, we have to rule out what it's, something that can be treated or cannot be treated with psychotherapy. So a hormonal imbalance, if it's diagnosed by a medical doctor, then your medical doctor is the best person to let you know how to directly address that. Is there any therapy to help you regulate your emotions? Many out there. Someone was saying DBT, CBT, meditative practices, but there is no whatsoever psychotherapy that is evidence-based to treat a hormonal imbalance directly. No, we can help to regulate the emotions or the emotional dysregulation that is brought about by hormonal imbalance and therefore psychotherapy. But psychotherapy cannot directly address hormonal imbalance. That's for sure.
I want to, if I may, I like to make a comment on what I understand to be our students, our audience. Mainly today, I believe those who are participating live are from Insight Timer, and so we have a weekly practice together, and I'm pretty sure these students who come to my class on Saturday, they did not vote for the wrong guy for president. So when we talk about anxiety, it's an accumulated effect. A lot of them really feel anxious right now. And in fact, one of the students comment about the current situation with the government and how it is perceived that not only what they do is unlawful, but that they actually are damaging our democracy in a permanent way. Anyway, I think a lot of the anxiety, and this is just one of them, is we feel that things are happening to us and we're losing control, or at least less control on one thing and then another. So if you think about all the comments they made in earlier, we're losing control on our financial future, thinking that we might not have enough money to retire, or if we're still working with AI, everybody talks about how, white collar jobs going to be replaced by, so we things are just happening to all of us. Health is happening to us. I call myself as, or many others call ourselves the sandwich generation, that we still have elderly parents that we have to take care of, and we still have children that we have to take care of, even though they're adult children. So we just get these things happening to us. And so I think it's that sense of loss of control that really
Absolutely. I
contribute to
think
anxiety.
you hit it right on the head of the nail. It's about control.
Yeah.
And I don't
And
think it was
when I hear you and knowing you now, seeing how you conduct your everyday life, is that rather than trying to control everything, we are just learning to be selective in what we can control and
exactly.
accept the stuff that we cannot control. That's why, like you said, if you want to judge me and you want to, do this, it doesn't bother me. So I'm not going to be bothered by that. Whatever you do is happening, but it's not happening to me. But on the other hand, you're picking very intelligently on what you can control, right? How
Yeah.
you can control your personal life, how you can control your professional life. And I think that's really the key, is not try to think that the world needs to be perfect and then everything has to be, in their place, and then try to worry about that. And
Yeah, and I'm not dismissing or minimizing the current political climate that we are in. I try to not discuss it because number one, I'm not learned in that area. I have very strong opinions about the current president, but this is not the place for me today. I know I would
it
have.
absolutely is a place, trust me.
But
I
I
know my
want
student.
because I want to talk about more of the psychological aspects of this. Like Dr. McMillan, like I said, you hit the nail right on the head that it's about control. And I think the last quarter's workshop, we talked about how we manage what's within our control and how we try not to think about things that are not within our control. And that's key. And the other thing is, I know Dr. Myung practices Buddhist psychology or Buddhist practices with your followers. I feel that that is very helpful in some way. I'm not a Buddhist per se religiously. I'm a Buddhist philosophically. And I've been doing meditation for years. I lead meditations, and there is not just the consciousness part, the mental processes part. Like today, when I led my students to do body scan, I did a very physiological kind of breathing with them. And sometimes I do ocean breath. And that inhale and exhale has a lot to do with our metabolic processes, that we are renewing ourselves. We are connecting what's going on in our mind with the relaxation processes that's taking place when we are doing the meditation. And I'm not saying that one session it's the psychotherapy that you all need. I practice this regularly. And I want to credit that for my calmness, my joy-seeking behaviors, and my ability to compartmentalize when I know that there's fires going on in my background, but I'm still able to maybe lead a yoga session per se. So what I'm saying is that our human nature, once we are practiced enough that this is what our brain is looking for, my brain during meditative practices is looking for joy, is looking for peace, is looking for calmness. Once it becomes a skill, once our body, our cells, our DNA registered, this is what this living thing, this being is looking for. We will strive to maximize that. And therefore, we talk about how meditative practice is important to us. And sometimes it's not easy to dive into it. It starts from a 3-minute thingy. It starts from a relaxation exercise. It starts from a box breathing technique. And it slowly leads us to what or where we want to be. And it takes practice. In Chinese, we call them xing. It's not just thinking about it. We need to practice it to shape our mind, our thinking, our behavior into what or who we want to be. And the exercises or the coping mechanisms that I'm listing on the screen right now, they are very simple. They are something that we have heard about every day. We have read about every day. We saw every day on our social media. But are we doing it? Are we doing this? Do we talk it out? Do we journal? Are we getting the sleep that we need? Do we exercise? Are we avoiding what's negative to our beings, be it diet, be it substances, or be it anything that we consume or inhale or put ourselves in the environment? These are the things that we think about that minimize the risk of anxiety. And I want to lead that into changing distress to eustress. It is not an on and off switch button. For example, I might as well share it publicly now. I have a biopsy coming up next Friday. I have medical anxiety per se, but I think about how I've practiced meditate. I do meditation and embrace the Buddhist philosophy. I embrace death. I have always been, since last month that I got the notice that I need to go for a biopsy, I've thought about how rich a life I have lived. I have still a lot to go forward from here, but my meditative practices help me become an accepting of what's going on in my life. I am a very busy individual, but at the same time, I, like what Dr. Mew say, I'm selective about what I should attend to. I have 16 weeks of classes or 5 classes to do. I do 2 weeks at a time. I do think about, week 6, I haven't done anything yet, but I do need to attend to this right now. As long as we are attending to something at that moment that we need to attend to, anxiety doesn't have the opportunity to sneak up on us. And how to turn distress into eustress. I do worry about how students benefit from my teaching. And that's a eustress for me, because I know that if I do my 100%, my students would like my class. My students would think that they are, getting their money's worth for their tuition. If I don't worry about that, then I'm not performing. But I also know that I put in enough efforts that I do not worry that that stressor become a factor for distress. A distress is when I have negative emotions about it. I have eustress. I know about classes that I have to teach back to back, but I know I have done enough to prepare for this week. Next week, I'll prepare for next week. I hope I'm making sense about this.
Yeah. There's a comment, a pretty long comment, and I think it is response to what I said about not be shy about talking about politics here. It's one thing to talk about politics in the classroom in a public university. I was a professor once. We don't do that. It's not the place to talk about politics. But on the other hand, this is a very self-selected group. And so I always said, just go ahead and talk about politics, because it is real. It is a big reason for our anxiety. And so this students, you said, the worry and anxiety is real. It is not about the president. It is about real people's lives and their families who are being harassed or threatened with harassment by their structure. Is supposed to be supporting our social health needs and educational support in a very real public school. We are journal the hell out of it. So,
yeah. And I so appreciate you, Dr. Mew, for providing that space and that you hold space for that for them.
Yeah.
And that's part of my, anxiety management. I am very, very vocal in certain areas, but I feel that this is not my place, because if I were to cross a boundary and discuss that, because I'm not one of your group members per se, and I do represent US today as the US professor, so I do have to hold my boundaries.
I appreciate that.
I honor the person who made that comment, know that I'm doing my part as a Free Mom Hugs volunteer. As a professor per se, I teach classes about stigma, dislocation. I teach classes about recognizing and helping marginalized groups. So if I were to take on one more hat, I'm crossing boundaries. And I might have one more thing to worry today and the rest of the week. And that's going to be a distress for me, where I'm not a professional or an expert in helping others in this area. I'm very concerned. I'm a very concerned person, American person in that area. But this is not my place per se. Yes, I do honor and appreciate your place and your support that you're creating that for your, if I may say.
No, absolutely. Absolutely. There are 3 of us here. 2 of you are still active academics. I happen to be a retired professor, so I have more freedom. Anyway, maybe there's one word that you use that I think would be a good word to kind of summarize today's session, which is functioning. You use that word more than once, and I think this is probably something that we can let me see here. We can use to ask ourselves, when we feel anxious, is it just everyday anxiety, or is it a disorder, as if it's an illness that somewhere in between, you have to say, well, am I a functioning person? I think that's, and I think.
And how do you define functioning? Well, in a very behavioral health perspective, functioning means you are able to take care of yourself in a very measurable way, that you are able to hold a job, you are able to fulfill your obligations, be it personal or financial. These would be the areas that you kind of gauge functioning. If
Yeah.
you're not able to care for yourself, that's the number one indicator that you are not functioning. And care for yourself, again, there are different parameters. What is caring for yourself? Are you taking care of your hygiene? Are you able to provide nutrition for yourself? Are you able to communicate when you need help? Those are caring for yourself.
Correct. So I think that that might be the word that we should ask ourselves first. In that spectrum, whether it's everyday or disorder. If you feel that you have a anxiety disorder, maybe you should at least try to improve it to a point where you are functioning.
Maybe can I add this also? If you feel that you might have an anxiety disorder, don't self-diagnose. Consult a medical professional. Go to a primary care doctor. Should be able to discuss with you what's going on. Do not self-diagnose. Do not go look up the symptoms and say, oh, I have this, I have this, I have this. Sometimes the professional and medical professional will be able to talk to you and sound out, oh, maybe that's not the situation, or maybe that's a natural reaction.
Yeah. The other comment I'd like to make is that somewhere in there you were talking about how you do yoga, you do Tai Chi, you do many things, and then you added, and I also do meditation. And I think to my students, I want you to think that meditation is not sitting down and paying attention to your breath. It can actually be mindfulness in motion. So in fact, yoga and Tai Chi and all those exercises that you do are meditation, forms of meditation.
May I qualify? I call them meditative practices. Meditation in my books, it's really about finding a very sacred time that you really are attending to the stimuli, both external and internal. Yoga, there is still, movements, exercising, running, those are all meditative practices. You are attending to what's going on in your mind while you are practicing. A meditation in my books, it's really dedicating that moment. It's mostly sitting down, you can have walking meditation, and then attend to what your internal stimuli are telling you and reacting and reflecting.
I don't disagree. I do not disagree. But the reason I brought that up is because somewhere in there you also mentioned, just very briefly, and says, your mind cannot do more than one thing at a time. And so I consider myself as someone who exhibits anxiety all the time because I have all this scenario in my head about things can go wrong. And I do two things. One is that I prepare for it as much as I can. And then the other thing I do is to say, well, just like what you said, what if the worst case happened? Well, everybody live. So you just kind of say, I did my best. If whatever happens, happens. But I think when we talk about meditation, and especially mindfulness meditation, whether you do that sitting down or standing or lying down or whatever, or running, just keep in mind that human being is the only species in the animal kingdom that is capable of all four. And so, there's no other.
So we think we don't know yet. As a scientist, I have to say 99% correct. We never know what 1% out there. Maybe some animals are doing all four. We don't know.
I don't, yeah, no, I don't.
I know what you're
But
saying.
what I'm saying is that we should stop. I'm not saying that your interpretation is wrong. I'm just speaking the way I normally speak, which is that since we're capable in all four postures, we should be able to meditate in all four postures. Now, when you meditate, whether you're sitting, standing, lying down, or running, it's all about anchoring your mind somewhere. You anchor your mind on your breath when you're sitting, and you anchor your mind on your body when you're doing yoga. Because you cannot do more than one thing at a time, if you could actually anchor your mind onto your body or your breath, then you're giving your mind less opportunity to wander off into what we've been calling irrational scenario. I'm not a therapist. I'm not here trying to heal anyone. I'm just saying that this is how I deal with my anxiety.
Thank you.
I
Thank you
just
for
stop thinking about it. But you cannot stop thinking about it because your mind likes to think. And so
thank you.
you have to give it alternative. Yeah.
Thank you for reminding that. And I've always thought about this. Like some of our clients would say that, oh, distraction is good for me, depending on whether the distraction is meaningful. Actually, one way of intervening with anxiety is distractions. Like if you sit there and you ruminate and you keep thinking about that thing, and then it leads to another, more negative emotion. And that's when, if you have a distraction per se, quote unquote, maybe a job or a healthy activity, or maybe going for a run.
Yeah.
These are all called distractions in therapeutic setting, but they have to be meaningful. So I do encourage all of us to look for distractions in our life so that we will stop thinking about the things that we'll ruminate on.
Well, Venerable Di Hong has been very polite and quiet. So I just want to bring out his contribution and his work, his daily work. He deals with people who are incarcerated. People, by definitions, have things happen to them as opposed to having control of the environment. Now, you can argue whether they deserve it or not. We're not talking about that. We're just talking about individuals that are being incarcerated in an environment that is 24/7 uncontrollable. And so what happened is that lack of control of the environment breeds fear, and fear breeds violence. And so when they're incarcerated, when they work inside the prison, the only common language is violence. And what Venerable Di Hong was able to do is to bring them in a environment where he gives them a distraction, just like you said, a distraction, which is anchor your mind on your breath. Sit down and just try to anchor on your breath, one breath at a time. And so that is a noble distraction, if you will, right? And so I'm not saying that would solve. I got in plenty of trouble trying to try to argue that someone who is suffering from certain disorder can actually just sit down and meditate and be done with it. I don't want to make that mistake again. That's, so I don't want to say that meditation is the solution to everything, but I just want to say in that context, what Venerable Di Hong and I do is a noble distraction. Venerable Di Hong do it on the breath, I do it on the body, right?
Yeah, if I may add to our audience, I think one thing is that the folks inside the prison, they have everything taken away from them. That's the other thing. And I think I would encourage our audience to, find some time and be mindful. If you cannot meditate, that's fine. Do something just so that you can be in the present moment, because life is uncertain and chaotic, and if we cannot control anything, we cannot fix every problem, but we can do is take care of ourselves. And by taking care of ourselves, we actually contribute some positive energy to our environment, to our society. We still have everything, right? We still have a place, we still have a job, we still could pay bills. Folks inside the prison, they don't have that luxury. They're separate from family. They also have to deal with uncertainty, violence, and not to mention this weather that we have right now. They have no AC in their cell, but they're able to say, hey, I'm going to sit still for an hour. There were so many times that when I walk into the chapel, some of the ladies, they said, hey, can we talk about Trump? I'm like, no. I have to politely say no, because it would take forever, right? And the staff was walking around, and I cannot let loose, So that's where I draw the line as well. Anyway,
that's the wrong place to talk about politics too. Yeah, I got that.
Thank you. May I just add one more thing before I take my leave? This was last semester when I did a community workshop that I certified people in leading meditative practices. And that's how I commonly use meditative practices, because in my books, meditation is really sitting down, leading to guidance, or really paying attention to one stimulant and be still with your thoughts. So one of them, actually a guest speaker, asked, is there a 3 to 5 minute thing to calm down my anxiety? I said breathing usually helps. You do deep breathing and regulate your heartbeat and regulate your mind. But think about an athlete who is supposed to perform in a 100-meter sprint. Do you think that this athlete only trains once a week or once every 3 days? No, the athlete trains 8 hours a day to be able to perform that world records. As for us to be really good with our meditative skills, we need to practice daily basis, sometimes 3 minutes, sometimes 1 hour, depending on what your schedule allows you. So we do not promote as in, oh, meditation, if you need it, do it and you'll calm down immediately. We promote that you do it on a regular basis and therefore able to regulate your emotions when you need to regulate your emotions.
Maybe one last thing I'd like to say before we end our today's wonderful session is to my student, and basically to say that you are not alone. Now, you have 3 perfect examples of someone who suffers who has a past history of anxiety or trauma or whatever. And what you see here is that we each deal with it in our own way and make sure that we're a functioning individual. And whatever it is, we turn it so that it actually gives us an edge in what we do, right? Venerable Hong, he talks about his past, talks about how he suffered from child abuse. Even at one point, he admitted that he had suffered sexual abuse, and he dealt with it in his way. I think in a way, he's still in therapy, and his therapy is actually to turn the table around and use his experience, as a weapon as a tool to help others, and by helping others, by maintaining his gratitude to what he has, a word that Dr. Kwok had used earlier, very grateful about what we have. He's able to go through his own therapy, right? Yeah. Your mic is off. And I think while you turn on your mic, I think Dr. Kwok already mentioned how she had to struggle with it. Go ahead. Go ahead. Go ahead, Rajapati Hong.
If I may add one more thing, for 5 years, from 2018 to 2023, I was traumatized and terrorized by my ex-neighbor right next door. Our houses were separated by 10 feet. And he came over to my house accusing me of breaking into his house. He always had a weapon, a piece of wood or a piece of pipe. And the one last time that he got into prison was he brandished an AR-15 in front of my house. But during those years, I felt powerless. I was hopeless, but I was still functioning. I still carry on my duties of going to prisons every week, every month. It's not that I'm strong, but I had no choice. That was what I faced, right? And that's why I had to wear a night guard. I think that was a form of because of the threat, and that I was grinding my teeth. And my periodontist told me that I was grinding my teeth. So since then, I had to wear a night guard at night. But it's something you guys are aware of, that we all have certain issues or anxiety, at least anxiety.
And there's another story that we never actually repeat, which is how I get to know Venerable Hong. It was that one time I was down in LA. I have this Chinese medicine doctor or acupuncturist that I know from when I was taking care of my father when he was suffering from dementia and diabetes on that. I used to drive him down to LA. And so one of our fellow students called me and said, Danny, and then we started talking, and he says, where are you? I said, I'm in LA. Oh, you're in LA. Yeah, you go to see Dr. Wong. I said, yes. He said, well, can you call this monk? And I said, well, why do I need to call a monk? He said, he said, well, he had an accident 6 months ago. He got ran in by a big truck, and his car was totally damaged, and he now is suffering from pain from his back, and that's how I actually got to know Venerable Putti.
Yeah.
And so this guy, he's got trauma all written over him.
And Joanne, when my car was total on Tuesday, the next day, that was August 24th, 2021. The next day, I drove to school to teach. We're putting on a mask for I had to speak for 3 hours throughout the whole semester.
So just kind of recap what one of the students says, is anxiety disorder a irrational, or is it a learned experience? It can be both.
Yeah.
You with all the experience that you have, these are learned experience, and they can lead to irrational thoughts, right? And you probably still have it. We just don't. Okay, maybe it's good. Do you have any comments that you want to make, Dr. Kwok?
No, I just want to, maybe it's my OCD, and OCD is a kind of anxiety disorder. I just want to really, classify anxiety is more about worry of the future. And the learned behavior part is a response to something that has happened. So they can both cause unease and discomfort and fear. But that's the difference about traumatic response and anxiety.
Okay.
But in any case, if you think there's something that you need to take care of, consult with a medical provider.
Yeah.
Thank you so much.
Since we are in a very self-selected group and not in a university or prison where it's considered a public forum, let me just use my French. I deal with my anxiety because I don't give a shit anymore. Sorry about that.
Okay.
I was expecting something more colorful. That was
No, this is I diluted that one. You have no idea. Okay, thank you so much.
I want to thank everyone for your attention, and I do not claim to be the expert of everything. This is part of my training and educational experience, and what my clients have shared with me, and the classroom, exposure. And if you have anything that you want to share after the training, this workshop via Dr. Mew, feel free. I am open to any feedback. Thank you so much for your time.
Thank you. Are you coming back in December?
I'm planning to, and the next one we will talk
you
about
committed 1 year. That I remember.
I'm going to worry about that in November.
Okay. All right. And I won't call you sooner than. Okay, thank you.
So
Hang on. Let me just turn off outside first, and then let me turn off these outside. And then we just say